A very good evening to all of you. Myself, Dr. Manasa. I'm a psychiatrist. I'm from Tirupati. We have a hospital in Tirupati by name Manasa Hospital. We deal with all kinds of mental illnesses and neuropsychiatric issues. Today, let's have a small discussion about early signs of dementia and what are the tips we wanted to give to the caregivers of the dementic patients. So, coming to dementia, dementia is a chronic, progressive, degenerative brain disorder which mainly affects the cognition of a patient without disturbing the consciousness. So, the patient will be conscious, but there will be cognitive decline and there will be behavioral and motor impairment also. So, how can we identify a dementic patient early? Usually, dementia starts in old age than in middle age. When there is a patient with dementia, the early signs usually will be the first and foremost symptom which the caregivers or the attenders complain is they'll say the person is forgetting everything, like the names of the people, names of the places, names of the surroundings, the addresses of the houses, and placing one thing and misplacing things, not keeping things at places, and there will be, other than memory impairment, there will be behavioral issues like anger and irritability, depressive episodes, weeping spells, all those things will be there, and there will be changes in language impairment will be there, and they will be searching for the words. The dementic patients will be searching for the words, and they will have difficulty in certain motor ailments like buttoning and unbuttoning of their shirts and tying shoelaces. They cannot do all those things, and they cannot write properly. All these things will be there. So the patients who commonly come to us will come with the main complaint of forgetfulness, besides some personality changes and behavioral symptoms. Some people, there will be a symptom called hoarding, which means the dementic patients will be collecting all the not very important things like newspapers or some kind of things which are not so important. They'll be collecting and keeping them inside the room or inside a cupboard or inside some shelves and all. So they will be preserving all those things, which is called as hoarding. So these type of symptoms also we can see in dementic patients, and these are the early signs of dementia which you can see in starting stages of the illness, which is called early stage, in around 2 to 4 years of the illness. So then the middle stage comes, and then the late stage will go. In the late stage, there will be gross dementia which cannot be treated. Means we can just give some neuroprotective agents, but dementia is always almost irreversible, other than secondary dementias. Means dementia due to other causes like vascular dementias or Lewy body dementias, all those things. Primary dementias like Alzheimer's dementia is almost always irreversible. They are not reversible. So these are some of the early signs of dementia, and the tips which we wanted to give to the caregivers of dementia. In India, about 80% of the caregivers of the dementic patients are the family members themselves. So most of the family members will be either elder daughter or son, or daughter-in-laws, or the spouses. 80% will be the spouses only. 20 to 30% will be daughters or sons or daughter-in-laws. So some tips which we wanted to give to the caregivers are: first, we have to treat them with respect. First and foremost, which is very important, is treat the dementic person with utmost respect and love. Second is, we have to wear a smile on our face when we are talking to them, when we have to address the issues. Third one is, we should always keep the surroundings which are known to them and which are very familiar to them. We should not always change the things in the room. Like one day if you keep the spectacles on the table and another day you will change it to the chair, nothing like that. So you should not do like that. You should always have one static place to keep their things, so that they will be familiar with those places only. And the rooms or the houses which they are living, it should be properly ventilated, it should be clean enough, and there should not be any hurdles for them to walk, go around and come back. So we should take our time to talk to them, to spend some time with them. We should give them some activities like gardening activities, and we can give some puzzles. We can make the grandchildren to sit and talk to the dementic persons at least once or twice a day, every day. And we should be aware of the sudden changes in their body, both body and mind. Like we should be very much aware about that, their medical illnesses, and what all, how all they are behaving, all those things we should be aware. And so these are some of the tips we wanted to give to the caregivers. And if they have any difficulty in looking after the dementic patients, there are many rehabilitation centers and dementia care centers all around India to take care of these patients. So you can always join there, and you can just go and come see them, and once in a while you can get them home, all these things. But most importantly, we have to treat them with respect, love and empathy, which is very, very important. And most of the elders, they are not getting all those things. So depression is very, very common in dementic patients also, even though they don't remember all these things, but they have got these behavioral changes, and even they'll get the suicidal ideations, suicidal attempts, all these things. So we should not treat them badly. Empathy is more important in treating a dementic person. So this is very important topic, because normal aging is different from this type of aging brain. So it can happen to anyone. So we should be aware of this dementia, and we should not think everything, what all they speak, what all they do, they are doing it on purpose. No, nothing like that. Dementia is a brain disease. It is a degenerative disease, and it is irreversible. So this is what I wanted to tell a few words about dementia and the tips for the caregivers today evening. Hope it all helped you. Thank you.